A new study recently done in the UK is the first to use Somali immigrants in examining Somali mental health barriers. The article, Breaking the Chain, Understanding Somali Mental Health Barriers and Health Inequalities, published recently, can also be read on our website, somalidispatch.com. It shows and explains why Somali immigrants are less likely to have used and consulted with mental health professionals and compared to the larger community which they live in. Mushtaq Kahin is a community engagement professional and a registered nurse associate. She reviewed the original paper, Crazy Person is a Crazy Person. It doesn't differentiate. We reached her in the UK for details. Mushtaq Kahin, welcome to Somali Dispatch. Thank you for accepting our invitation and for your time and in allowing us to dive into this study about Somali mental health patients, this case study done in the UK, and some of it references Somalis in Canada, where I am. And I think there is a bit of a generality in those circumstances. So thanks for accepting to disseminate some of the information included in that study. Can you tell us what this study entails and how it began and your involvement in it?
Okay, so thank you for having me on. So I saw this article last year. It was published last year. It's not done by myself, the research itself. It was done by two Somali researchers and one Chinese and one white researcher from Bristol University, and it captures research and views from Somali Bristol community, which is a small town in the west of England. And it's quite interesting because there's a lot of research, a lot of research that's been done on Somali communities. It has been about more than a decade ago. It talks more about refugees. So this is a more recent one, which, it explains the difficulties of barriers of access in mental health care. Somali people, we tend to have a higher rate of mental health problems. The reason being is one of the main causes is because we went through a civil war and we came here as refugees. We faced discrimination, racism. It's a complete culture shock, adjusting. People growing up, they might have identity crisis. And yeah, there's also an intergenerational gap as well between parents and young people. So I think it was a quite interesting study, which, I think it's a worldwide issue. Yeah, so I think it is a quite interesting study. I think especially in the community, all communities, Somali mental health, there's a big stigma, not just in the Western world, but also back home. When you go back home, people are chained often, or they are locked up in these places where, like so-called rehab, but there's no proper mental health care. There's no hardly any mental health nurses. I think about 4 psychiatrists in the north, in Somaliland, and I'm not sure about Somalia. So people tend to go to spiritual routes and they are suffering. But where we here in the West, where we have the resources, people come often in crisis where there is no need for that. And to understand the community is how we can get the solution.
That's a pretty good summary of what the study entails. What are out here in the West, what are the main challenges Somalis are facing in diagnosing a mental health?
Okay, so obviously I can only generalize. There's a huge stigma. We tend to think quite black and white. So once somebody becomes mentally unwell, we think that's it, there's no recovery, they're forever mentally unwell, which is not true. So we have a lack of understanding in mental health. And also there's also fear, which is understandable, fear of mental health services. So often you hear people say, oh, they get injected, which what I mean is by depot, which is just a form of medication. And I think also once mental health problems get involved in families, then you have social services. People don't tend to, in general, they don't tend to believe in medication. That doesn't not only happen to Somali people, but just there's a lot of, they don't really tend to believe in medication when it comes to mental health. But when it comes to physical health, people take medication without no issue. So Somali people, just like other communities, they tend to go to spiritual treatment, which is fine. It's absolutely perfect. The only issue is some conditions they need medication for that, and for every illness there's a cure. But because of the stigma, people tend to hide, and because they tend to hide, they don't get the access of support, and then you have people coming in crisis, which is not ideal, or they get sectioned under the Mental Health Act, which is not ideal either.
Correct. Obviously, the study references the use of CAT, for example, and the history of violence in their home countries when we're talking about Somalis. What are, and it was interesting that in the study, actually, CAT was referred to as a pastime sort of a thing and not as a drug. But I know later in the study, it also talks about it being a mild drug. But I thought that was a little bit interesting. What are some of the other contributing factors that could further exacerbate mental health conditions, generally speaking?
So, for example, social circumstances, unemployment, for example, especially in the city that the research was mentioned. The CAT reference was just me getting more information about other contributing factors of mental health. So trauma, a lot of Somali people are suffering with trauma. They might not recognize it, and that's the lack of understanding. There's a saying, 1 in 3 Somali refugees suffer from post-traumatic stress disorder, which is kind of understandable because even though I was quite small when we left Somalia in 1989. A lot of people have seen a lot of horrific stuff, and they don't talk about it because in our culture you have to be strong. People have had their family members killed in front of them. People have been killed because of their tribe, and then it still continues going on. We have problems in the south, and it's just horrific. And so that you have the trauma, which is, and also we don't do talking therapy. We don't do talk. We will never share our problems. Forget, let alone with Somali people, let alone with non-Somali people. And then we have lack of Somali mental health professionals as well. So I think other issues are also in a way poverty, unlike Canada and America. I would say more Somali people tend to be more successful. So you have poverty, loss of children, again, a lot of responsibility for the Somali mothers. That's, wow, I'm not generalizing, but I won't go into it. But then there's in the study, it talks about Somali fathers being absent, talking, and they are able to talk in the cafe about, their socializing, which is good for mental health. And then you have the mother stuck with the children,
which is not good for mental health.
But it's not good for mental health. So, and that's also a
right.
Contributing factor. And especially if you don't speak the language, it's kind of isolating as well.
Yeah, coming from a homogeneous society to a multicultural society, and for the first time perhaps experiencing, while we're familiar with tribalism, experiencing racism, I think vastly contributes. And I see a lot of our comrades here grappling with that and not being able to differentiate. For example, when someone doesn't like you individually, or when they don't like you because of your color, right? And the intergenerational is very nuanced in Somali culture, and talking about how things are passed on genetically to your offsprings. And we can talk about that forever. That's an interview on its own, because I had an experience where I spoke with some youth about how exactly their parents get to North America and Europe, and they couldn't fathom like the stuff that they had to. Of course, they hear about the boat people, this and that, but I think they thought their parents just immigrated and they weren't like refugees and stuff. So that caused them a lot of trauma, me recounting those stories to them. But in this study, Somali men and Somali women, just like you just did, described and talked about mental health differently. What were the differences that stood out in this study for you?
Yeah. So I just going to read my review.
Yeah.
So the men in Bristol, they talked about socioeconomic factors such as poverty, unemployment, homelessness, trauma, language barrier between mother and child. Funny enough, they didn't mention mother and father and family separation and conflict. Whereas the Somali woman talked more about family dynamics, lack of sleep in children, gender roles, the belief of they also believe that there is a genetic risk, which is true, that there's some genetic, tend to be more at risk if you have serious mental health illness in your family. And also they talked about physical symptoms, which is something I recognize. They talk about headaches, and sometimes I can see anxiety in people I know myself. They will never recognize that as anxiety, but it is anxiety.
It's
just
true. It's
yeah,
true.
they
Yeah.
just don't realize that it's anxiety. Yeah.
Yeah, and tiredness and all of this. Yeah.
Mhm.
There also was a difference in kids responding or younger generation responding or how they viewed how mental health is manifested in the household, for example. And that I thought was really interesting, which spoke to the cultural gap between generations. What were the key recommendations for Somalis and relevant organizations that deal with this grave concern? What does the study point to us in going the right direction in dealing with these things?
So the study, based also what the community wanted, talked about having a link worker. Interestingly, they said about somebody who's older. I guess somebody from who's older of the Somali community. I guess shows again the trust aspect of that. They talked about community services. So which is correct, mental health services going into the community. They talked about standby interpreters at the GPs, which is like a family health practitioners. And I guess also more education, mental health awareness, which is very important. Otherwise, how can you recognize something if you don't know if it, the symptoms or how it, what it's about. I find that also as a Somali mental health professional, I know, for me, because I work in this field, so I have a bit of a more of an understanding. But what I find quite interesting, my observation is that yes, there is serious mental health problems. There's mild mental health problems like depression, anxiety. I mean, it does not discriminate. And in our hadiths, it talks about anxiety. It talks about depression. So religion is actually at the forefront. The first Muslim hospital, psychiatric hospital, was actually in Baghdad in Iraq. Even though the Western world claims that it was in one of the hospitals where I worked in London, but it's not. And we were at the forefront when it comes to, even psychotherapy has an Islamic origin to it. So we were at the forefront. We were treating mental health and physical health for free way back in 70, 100 AD, I think. But then we have gone back. We have really gone backwards in many things. The Muslim society that were at the forefront when it comes to science and math and philosophy and medicine. We were, but we have gone back. So now there's a lot of cultural and stigma. So one thing I've also realized that, like for example, there's no words of in our language. There's no words for depression.
Yeah, that was interesting finding. Yeah.
Yeah, so we don't have any diagnostic words for mental health illnesses. And another thing, if you talk to Somali people about personality disorders, there's so many personality disorders. And personality disorders, I mean, it stems from trauma, and we don't know. So we recognize the symptoms of narcissism, for example. I think that is something that is quite kind of like common in our community, narcissism. But we can't recognize that. When I say narcissism, when it comes to leaders, for example, Somali leaders, because what's going on in our country, where people are very selfish and the people are suffering. And yeah, so people don't talk about that. And they have no understanding of that.
Right. Much is when it comes to mental health and these personal problems, it's two-pronged attack on resolving some of these things. One is coping with it and being resilient, and it has nothing to do with that. It's a situation that goes beyond one's control. And the other one is obviously the denialism and attributing it to just things like jinn and, you know, and the shame of it. It's fascinating to read this. Are you at some point, or is someone going to translate this very well-written study into Somali, or perhaps even in Arabic, or so other communities who are going through this can actually benefit from this?
I actually haven't thought about that, but that's a good idea, because a lot of research is not accessible to the people. So that's a good point. So I might look into that. I don't know how to read Somali or write Somali, but that's a good point, though.
Well,
and
perhaps we can put it out there to some people to reach out to both myself and you in undertaking this endeavor. And this is the reason. One of the reasons I've established this channel is to perhaps bridge that gap where Somalis even back home can leverage the knowledge that young Somalis who are currently living in the diaspora to contribute back to the country. And I think this is a valuable way of giving back to the community. And I think there's going to be a lot of appreciation for that, because you know, this vast condition, and in talking about it is one thing, but getting it to the masses is actually the real work that we somehow need to figure out how to do. I can't thank you enough for coming on and talking about this, and perhaps have you know, an ongoing discussion, and perhaps focus on certain aspects of mental health next time, so we can instead of talking about it broadly, we can specifically talk about certain aspects of it. I immensely appreciate you coming on and taking some time out of your working day to talk to us. We appreciate it very much, Mushtaq.
Welcome, Abdikar. It's a pleasure. Thank you.
Hey, thank you for visiting our YouTube channel. You should know that you can follow today's top Somali related news in English by visiting us at somalidispatch.com. And you should also subscribe to our YouTube channel here to watch interviews with newsmakers. Thank you.